Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. ASA stroke risk not increased for patients with cervical artery dissection with DA in first 180 days. MedNews. About 19% of patients with cervical artery dissection, CeAD, have a dissecting aneurysm, DA. Patients with DA are more likely to be non-Hispanic, have a history of migraine, connective tissue disorder, and minor neck trauma, and are more likely to present with ischemic stroke. 10% of patients with DA on presentation had DA growth, but there was no significant difference in the risk of ischemic stroke by day 180 between patients with DA or DA growth. The study provides important information to help healthcare professionals better monitor and manage patients during the first 6 months after diagnosis of an aneurysm. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak